Okay, now we're going to look at a physician who is what we call a non-participating provider or a non-par provider, which means that accepts assignment. When a physician accepts assignment, that means that they are going to accept whatever the allowed charge or whatever the insurance company's fees is set for that particular service. And we're looking at Medicare again. So when we look at a non-participating provider, because they're a non-participating provider, Medicare penalizes that particular physician by decreasing the amount that they're going to actually reimburse them. So we're going to look at the same scenario here. We're looking at where a physician is going to charge $120 for a service. Well, this physician does not participate or is not as a non-participating provider. So what happens is Medicare is now going to only reimburse a maximum of $57 instead of the $60 like we had in the last example. So what we need to look at then, Medicare is still going to pay, it's still considered an 80-20 policy. Medicare pays 80% and the patient or their supplemental plan is going to pay the other 20%. So what happens with this particular case then is that Medicare still pays their 80%, but they're only going to pay 80% of the $57. So which now is 57 times 0.8, which is going to give us $45.60. Now the patients for their supplemental plan is going to pay 20% of that same $57. And that's going to give me $11.40. So we still have to, the physician, even though he's a non-participating provider, he still has to write off the difference between what he's charging and the Medicare fee. So in this particular case, the physician's fee is $120. Medicare says that the maximum that he can collect for this particular procedure is $57 because he does not participate in Medicare. So when I do that, he is going to have to write off now $63.